Welcome to Life Sutras, where we have empowering conversations with thought leaders that will inspire you to be a healthier and happier version of yourself. We will explore science, the subconscious, as well as the spiritual. Good health equals harmony between many dimensions of mind, body, environment, and the unknown. Welcome back to another episode of Life Sutras. I'm your host, Aanchal Bhatia, coming to you from Sydenham Clinic. I am the founder and CEO here, but more importantly, this podcast today is in my capacity as managing trustee of Breathe Easy India and Breathe Easy USA. Some of you may be aware of the global crisis that's happening because of the second wave of COVID-19, and India, unfortunately, is the worst affected. I have with us two renowned doctors who are frontline physicians, been at this disease in the middle of the pandemic for the last over a year. Dr. Surinder Kaul, who is the medical director of Baylor College of Medicine. There is a hospital in Sugarland where he's called CHI St. Luke's, where you're the medical director, but he has been the medical director of Bentop Hospital, which is the main teaching arm of the Baylor College of Medicine for over 11 years previously. He's also the teaching faculty at Baylor College of Medicine. And we have Dr. Nashat Latib, who is a board-certified emergency medicine physician. She is also one of the only 1,500 board-certified IFM-trained physicians in the world. And we are very fortunate that Dr. Latib is joining our team here at Sydenham Clinic and will be looking after our members. She is an ER frontline physician who has been a medical director of different ERs and also been very involved in COVID. Dr. Kaul is extremely passionate about what's going on in India today from many points of view, but he's part of the global Kashmiri Pandit diaspora where he's doing a lot of work. And I just want to put a disclaimer out there. Today, our goal is to empower you to be the CEO of your health. We want to alleviate the fear. We want to reduce the panic. There are many things we can do in our individual capacities if we get infected or if a loved one gets infected with COVID-19. We're not giving you medical advice. We are not paying you to say this. Please understand this is being given out in public interest, and we're just doing this, as a service today. So with that, I'd like Dr. Kaul to please explain what is this crisis and what's going on.
Thank you, Aanchal, for inviting me. It is a privilege and my pleasure to be here. Before I make any comments, I would like to reiterate that a disclosure that I'm not being paid for this service. This is a medical advice based on the humanitarian crisis, and I'm doing it on my personal capacity. My institution is not involved in it, and in good faith, keeping in view the alarming situation which is evolving. It's true that COVID-19 pandemic has been there for last 1 year, and we have seen that almost all countries have been affected very, very badly. And we have had first wave of COVID-19, especially being in US, we have seen the worst. And we are now seeing second wave in certain countries and third wave in some countries. Now, India is struggling in this second wave. They did fairly well in the first wave, but second wave is really impacting and threatening human lives. So COVID-19, there are also lots of misconceptions because there's a lot of knowledge and it is adding to the confusion. As a scientific fraternity, as a medical fraternity, I would like to inform the audience that it is an unknown disease which has been here for last 1 year. So there are lots of unknown yet, but in last 1 year, we have studied and we have understood lot of behavior of the viruses, this particular virus. And we have also seen what is working, what is not working. So I will just navigate about you to this may elevate some anxiety, the fear in your minds. First of all, it's true that COVID-19 is very contagious. Now, 81% of people who are affected with COVID-19 infection, they can be either mild or they can be moderate. So this 81% of the population, almost to a larger extent, can be managed within the comfort of the homes. So there is a lot of panic that anybody who is being diagnosed with COVID-19, he or she is rushing to the hospital because of the fear. But I hope this podcast will be very helpful to you, that 81% of the patients who are mild to moderate symptoms, they don't need to rush to the hospital, and I'll be talking about the warning signs when they need to go to the hospital. So first of all, the symptoms. The common symptoms of COVID-19 can range from fever, which can be high grade with chills, body aches, sore throat, cough, and we have seen that the studies have shown that it impacts the sensation of smell, the sensation of taste, and then some patients can also have diarrhea. So these are the common symptoms, and the incubation period of the disease is somewhere around 14 days, but most of the patients who develop COVID develops it within 4 to 8 days usually. So what to do when you have these symptoms? So most of the patients who don't have any comorbidities like diabetes or underlying cancer, you will do fairly well. There are certain exceptions to this, but most of you will do fairly well. And there is most of the patients with COVID-19, there are different scenarios. I know there are lots of treatment protocols that steroids help, remdesivir helps, convalescent plasma help, but there is also lots of misinformation that everybody is running towards getting the antibiotics, getting steroids. These are the medications, and every medicine has specific indication. So let us take one by one, if you permit, Aanchal.
Yes, please. That's exactly what's happening. People are hoarding medications. There's counterfeit medication that is being sold in India, and everyone is sending out hundreds of WhatsApp messages. I need remdesivir. I need plasma. Does everybody really need it, and who needs it and who doesn't?
Yeah, it's a very good question. As I said, most of you who are well, they contain COVID, they get fever, they get body aches, it's fine. I would suggest that every family, which has turned out to be beneficial, is to monitor your oxygen levels. Oxygen, oxygen, oxygen. So we get pulse oximeter, which is readily available and it's not expensive. And any COVID patient who is being diagnosed with COVID should test his oxygenation levels 3 to 4 hours, every 3 to 4 hours, and see how is it. Now there is again a misconception, miscommunication, misinformation about oxygen. Everybody thinks that, oh, my oxygen level is 98%. So their impression is that the oxygen has to be 100%. And that's not the case. Any oxygen above 90 or 92% is absolutely okay. And body can cope up very well with that. So if you have COVID and you have oxygen saturation of 97%, you are fine. You don't need to take any antibiotics, you don't need to take any steroids, you don't need to take anything, just wait and watch. But take precautions. Important thing which supersedes everything is that you isolate yourself. If you have symptoms, even if you have not got tested, please isolate yourself immediately. And what is that isolation? Preferably go to a separate room, use masks, and the household members should wear masks and maintain strict social distancing. Now the question is, do you need to be tested for it? I know in pandemic there is a lot of crunch, there's a lot of pressure on the healthcare system. Maybe you may not get a turn to get tested, but you don't have to wait for the test. In a pandemic, if these are your symptoms, unless proven otherwise, it is COVID-19. So in the absence of the test, just isolate yourself. But yes, whenever you get an earliest chance of testing yourself, please do that.
Yeah, and I just want to bring up one thing, which is that the rate of false negativity of tests, right, is also very high. So even if you do end up going and getting tested, if clinically, I always say if it looks like a duck and walks like a duck, it's a duck, right? So if it looks like COVID and acts like COVID, as far as I'm concerned, it's COVID. So I think that there's a, you know, there's sort of a gray area, and the safest thing to do is assume you have COVID and take proper precautions.
I fully agree with you, absolutely. With this, now there are different scenarios what to do. What are the warning signs that your dad is there, your mom is there, your sister is there, your wife is there, you are there. So what are the warning signs that you should be alarmed and you should seek medical intervention? So the symptoms that I talked to you about, fever, body aches, these are the inflammatory responses to any infection. That body has its own self defense mechanism. So it is using, the body is capable of formatting an immune response. So this is good. So nothing needs to be done. You don't need any antibiotics if your oxygen saturations are anything 94, 95% and above. In specific cases, it may be slightly different. We can discuss that. But if it is that you don't have any comorbidities, you are good. Alarming signs. If you have persistent shortness of breath. Shortness of breath is definitely one of the signs, and persistent. We may become short of breath because we have anxiety. But no, if there's a persistent shortness of breath, that you are doing a activity you were doing without any issues in the past, and now for last some days you are feeling that doing this small activity is making you short of breath, yes, first please do check your oxygen frequently. And when I say check your oxygen, it is not at rest. I have seen many patients whose oxygen saturation at rest can be 96%, 97%. And when they are talking to me or to their physicians, their saturations come down. It comes to 93, 92, 91, 90, 88. So important thing is that check your oxygen also when you walk for 5 to 6 minutes. That is actually the actual oxygen reading that will help you.
That's
now,
a great point.
yeah, do you have anything to add?
Yeah, no, that's a great point. And I think it's also important to acknowledge what your mental state is when you're checking your oxygen, because if you're hyperventilating and you're extremely anxious, you know, there's a potential that it could throw off your read. So you really just want to make sure that you're in a controlled and calm state, and as you said, have some mobility while you're checking your oxygen for sure.
Right. Another important thing is oxygen. So oxygen is a number game. Now, if your oxygen is, I must say, you know, there are different studies, but because we are talking about the common people, and maybe you may not have access to a physician because physicians are busy dealing with the pandemic. So what I would suggest that if your oxygen levels are persistently dropping, whosoever it is, your father, mother, any of your loved ones, if it is dropping, and if it is dropping around 94%, usually we see 92% and below. But for keeping a window so that a patient doesn't drift towards the severe disease, it's important that you maintain 94% and below and seek medical attention, all right? But not in the way that you start running towards the hospital, but check out that is it that available, because in that process you are doing more harm to the patient if he has such situation. So that is important about oxygen numbers, importance about the warning sign of shortness of breath. So these are the basically 81% will be categorized to this category with mild to moderate symptoms. Then we have 14% of the patients who are categorized as severe COVID infection. And these are the severe COVID infections who need to be in the hospital. And then we have 5%, 4 to 5% of the patients who are critical, and those who need to be in the ICU. So why I am saying this is, please do not have panic, because panic makes things worse. have a positive outcome of this infection if you deal intelligently, cautiously, and take all the steps. You will escape. For an example, I have been dealing with COVID patients for the whole year, and I have been seeing them in the ICU, seeing them on the medical floor, and in very, very close proximity. But we use gowns, we use face shield, but I have not got COVID infection. So that is a positive note that if you do certain things carefully, you will definitely escape and defeat this virus.
Which brings a very interesting point, because a lot of people are declining and landing up in a situation where they need hospitalization or ICU beds because of lack of care. And parents are left to fend for themselves, who can't do anything and they don't know how to do it. So they're just bedridden and they're falling more sick. So how do you look after a loved one who's got COVID and you're living in the same home? Can Dr. Latib and you maybe, tell us how you do it? Because you're frontline too in an emergency medicine environment and you're around patients all the time. So how can we look after a loved one?
Absolutely, absolutely. That's a great question. And there's some of those answers are so basic, right? They seem so basic that it's almost counterintuitive, and I think people forget about the basics. People forget, for instance, that our bodies are mostly made of water, and water is an essential part of every cellular functioning process and every biochemical process. So something as simple as encouraging your family member to drink water. How much? A general rule of thumb is half of your body weight in pounds, in ounces, is how much water you need to drink to maintain proper hydration for all of the essential organs. Movement. Movement is such a critical part of recovering and healing during the inflammatory process, because COVID is essentially an inflammatory insult on the body, right? And so if we can supply our bodies with the hydration and nutrient, vitamin, and mineral intake that is needed to support our cellular function, we're going to recover a lot quickly.
So don't just lie flat in bed if you're diagnosed with COVID-19.
Absolutely
keep walking
not.
In your room, keep moving. That's essential.
Yes. If you have stairs, go up and down stairs. That's a great way to get things moving. And also remember that if you have COVID, there is an association with becoming hypercoagulable, right? So there's an increased association with things, for instance, like clots. How do you prevent them? You keep moving. If you're going to stay in one place, then the chances of you having complications from COVID are going to get a lot higher. If we keep moving, whether it's walking around, and the thing is, the studies that have looked at movement and its correlation with chronic diseases like COVID, we're not talking about you having to go and do a serious workout. We're talking about just push yourself a little bit. You're walking a little bit faster than normal, then go slow. And if you can alternate between moving fast and moving slow, you're actually really exercising your cardiovascular health. So those are just a couple of
What about breathing
things.
Exercises?
Breathing exercises are amazingly amazing. And
even if I have COVID,
even if you
and
have
I'm
COVID,
sick and my saturation is in its early 90s, should I be doing it?
Absolutely, absolutely. And breathing exercises have so many benefits. One is we inflate the lungs, right? So we're filling the lungs up with air and deflating them. And not only does it actually serve your lung capacity and keep your lungs fully and physiologically inflated, but it also, it also works with our parasympathetic system and decreases stress. And decreasing stress in the process will also decrease inflammation, which is also going to help the body heal. So one of my simple things, it's a very simple way of breathing, is 4-7-4. Mm-hmm. So you inhale for 4 seconds, you hold it for 7, and then you exhale for 4. And if you can do that rhythmically several times, it actually will help maintain your lung capacity. It will help increase your oxygen intake. And it will also decrease stress, and it's like a form of meditation.
So this is great. I know there's lack of oxygen out there, but we can take simple steps to make sure our lungs are at least taking the adequate oxygen that's available, at room temperature or atmospheric oxygen. So please, take note of these small things that we can do.